I've never seen everybody so quiet in my life.
Speechless.
Good morning. Good morning. I'll hand it over to Jim to start our public board meeting. Go ahead, Jim.
Thank you, Victoria. Welcome and good morning to the Fraser Health virtual board meeting. I want to start by acknowledging that and recognizing that the Fraser Health provides services within the ancestral, traditional, and unceded traditional lands of the Coast Salish and the Unlaka'pam Nation. I also acknowledge the important work and contribution that Indigenous people make to our community. And I want to also thank you for tuning in today and we hold public meetings in this format to help us to stay connected and keep informed. And hopefully there will be time when we can do this back in public. We're all looking forward to that time. Let me start by introducing the board members. Inderjeet Hundal, Manpreet Grual, Jesse LaHale, Nicole Aislinn, Willie Charlie, Ramya Hozak, Opreet Kang, and Dr. Dennis Wardman and Cynthia Jim. The last two members I introduced are new members of the board and welcome them to the board. I also want to take a second to introduce the executive. This is the executive of the Fraser Health Authority, and they have been leaders in the battles against They've been leaders in the fight against COVID and done amazing work, and I want to thank them for that work. Dr. Victoria Lee, who you can see on your screen, is the President and CEO. Cameron Bryan is the VP of Employee Experience. Elizabeth Brodkin is the VP of Health and CHMO. Brenda Leggett is a VP of Integrated Commercial Services and CFO, the Chief Financial Officer. She keeps track of the money, which is a big job in our authority. And Nassim Narani is the VP of Communications and Public Affairs. Norm Peters is the VP of Regional Care and Integration. Linda Dempster is VP of Patient Experience and Pandemic Response. Kayla Newfield is our newly appointed VP of Indigenous Health and Cultural Safety. Brent Crushaw is VP of Informatics, Technology, and Facilities. Linda Dempster is the VP of Patient Experience and Pandemic Response. Dr. Ralph Bell is the VP of Medicine. Lori Leith is the VP of Regional Hospitals and Health Services. And Dermot Kelly is the Hospitals and Health Services. Thank you for being with us today, joining us today. As the largest and most diverse health authority in the province, we've experienced our fair share of challenges over the last couple of years. There have been more cases of COVID-19 in Fraser Health region than any other area in the province. And the efforts to respond to these cases has been truly tremendous. So I just want to start by thanking all of the staff and the medical staff and the volunteers, and also the local governments and the community, our industry partners, everyone in our community. Truly the last 2 years, the challenge to keep ourselves safe, to take care of those who have been sick with COVID has been an enormous one. And it really has been a collective effort to make that a possibility that we're here today. Hopefully looking in the future, in a brighter future. That work has included expanding COVID-19 vaccines to children ages 5 to 11, and to ensuring access to immunization clinics for booster doses, to working through periods of extreme weather, including a heat dome, flooding, cold weather, and snow. Our teams have been doing extraordinary work in tough conditions. And now spring is around the corner. We look forward to more light in our days, more opportunities to reconnect with our loved ones, and resuming our favorite activities. But for the sake of those most at risk of COVID-19, we must continue to be vigilant and ensure that we protect public health. That, of course, is our #1 job. I also want to say that we were very successful and we're optimistic and hopeful. To date, more than 3.9 million vaccines have been given out in Fraser Health alone. And again, I thank you, especially to those people who have staffed those clinics and made them work. Our vaccination rate for people ages 12 and older is 94% for first doses. That's probably the highest of any jurisdiction, and 91% for second doses. So I encourage you, if you've got the first dose, please go and get the second. That's higher than the provincial average anywhere. People in Fraser Health are doing their part and should be proud. That includes the many community partners who are supporting the effort. As immunization continues to increase, we continue our crucial work of addressing urgent needs in our health system beyond the COVID-19 pandemic. We are all devastated by the chief coroner's announcement recently that in 2021, Fraser Health had the most deaths from illicit drug toxicity on record. In our region, 765 people, important people, sons and daughters, wives and husbands, children, lost their lives to overdoses last year. This public emergency continues to be a priority for our organization. In the past year, we've opened new mobile overdose prevention services in Abbotsford, overdose prevention services in White Rock, a rapid access to addiction care clinic in New Westminster, and more. These investments into substance abuse services are critical to addressing the public health overdose emergency in our region, and we will continue to expand our services, including safe supply, to save the lives of people who use drugs. This remains a top priority for the authority. We also remain focused on the urgent work of eradicating racism in our health system. Racism and systematic inequities create challenges when people seek care, and we are just addressing this across our system as we work to ensure we place diversity and inclusivity at the forefront of everything we do. It is a priority for Fraser Health and our board. We are also very committed to introducing UNDRIP, the United Nations Declaration on the Rights of Indigenous People, and to working to end racism in all parts of our system. We recognize that racism is also a deadly disease and that it's extremely harmful to people who experience it. And we do acknowledge that it still continues on in our system, and we are working together with all of our partners to eradicate it. We are preparing to face new challenges this year, but we're grateful to everyone at Fraser Health on this call for what you're doing to protect our communities and support us as we provide care. We hope to see you following the public health orders and guidance, wearing masks, getting vaccinated. If we can keep up these efforts a bit longer, I hope that one day in the near future, we may meet face to face. Now I'm pleased to share today's agenda with you. And first of all, I'd like to take the opportunity to have the chairs update you on our activities. The board works as a board, and then there's different committees underneath. And today you'll just get a brief introduction to those committees. I'd like to start with Oprah Kang, who's in charge of the chair of the Quality Committee.
Great. Thank you very much for that, Jim. Yes, I absolutely appreciate the opportunity to share more of the workings of the committee. For the purposes of today, as we kick off this inaugural process, I'd like to give an overview of the type of conversations and dialogue that we have in collaboration with our senior executive team and others informed on those subject matters. So essentially, this is the committee where we get to hold ourselves accountable to our slogan, better health, best in healthcare. And so that includes receiving information and reports related to the medical staff improvements, the staff improvements, and some of the work that they're doing in terms of being able to deliver on the best possible quality of care. And some other monitoring reports, examples of that include the patient safety priorities that have been outlined in the Fraser Health region. And also the work that is being done in collaboration with our various sites and staff, again, giving those inputs. And some of those inputs also are from you, the people that are using our services, the patients that have gone through the services. Those inputs range from things that we're doing well, but certainly we also want to know when we're not doing well. And those opportunities for input come through our patient Patient Care Quality Office, the PCQO. Links to those opportunities to provide us with feedback are available on our website. And we do have a process where we take those feedback, again, those things that we're doing well, those that we're not doing well, and be able to, through that process, address it and have the learnings shared at this committee, but also an understanding of how they're being implemented throughout the system, so that those lessons learned are valued. So thank you for that ongoing input. Again, as we go forward at these public board meetings, as Jim has said, hopefully we have an opportunity to engage in a more robust conversations. I'll be bringing forward some more structured updates as well. So thank you for that opportunity.
Thank you, Preet. I'd like to introduce Mandy Gruel, the chair of the Community Transition Committee.
Yeah, thank you, Jim. My pleasure to talk about our Community Transitions Committee. As the name says, this is about the board providing some strategic direction to whenever services are being transitioned into the community. One of the easy definitions when I joined the board was that whatever is happening in the settings outside of the hospital is probably what is covered within our committee. So that includes things like the long-term care facilities, the home supports, also the primary care and the urgent care centers, mental health and substance use services. And also we are dealing with the overdose crisis, which is happening out there in the community. The committee is comprised of all of our board members. So the interesting part of our committee work, I think my other colleagues will share that too, that there is some crossovers, because there's financial implications. So that all is discussed at finance, because everything we do has a transactional sort of a component. There's of course also a quality care component. So what Preet's committee might be discussing might sort of like spill over into our committee as well. Likewise with digital with Jesse. So the discussions are always very robust. There are things which we are trying to carry out as an instrument of public policy. For example, the urgent and primary care centers. We get mandated as a board to say we need to open these many, and then you sort of are seeing how those are implemented, what are the challenges. And of course, there are challenges. It's a complex system. Attracting human resources is always a challenge. Full complements of staff at those sites is a challenge. So we all wrestle through all of that alongside the executive and try and see how problems can be solved in a way where patient care is becoming more and more seamless and more improved out there in the community, and also that patients have more voices. One of the things which I got the opportunity to do last week was visit our urgent care center in Abbotsford. I am from Abbotsford, so that was really very nice for me. And one of the things which really becomes very striking is how our system is designed to do some things, but then is also responding to a lot of things. Jim in his opening comments talked about the heat dome and the floods. So one of the things which the Abbotsford Urgent Care Center did, of course, it became a COVID site for a while because we all had to respond to that. But also when the fires broke out in Lytton and there were evacuees in Abbotsford, the UPCC actually provided primary care to those individuals, whether it was at the hotel sites or whether they could come to the center and get that access. And a lot of the population which was evacuated was First Nations, and there was that cultural sensitivity component at the urgent care center in terms of the staffing, which really made the connections very well. People were very appreciative, and actually they continue to see that individual at the UPCC. So there's always these little rewards, like even as we work through challenges, there's always these little nice stories which make us feel that very grateful for everybody who's involved, from our staffing levels to our board levels in this work. So thank you, and I look forward to having more discussions as we start to meet in person.
Thank you, Manpreet. I'd like to ask Indrajit Hundo, the chair of the Governance and Human Resources Committee, to say a few words. You're on mute, Indrajit.
Thanks, Jim. I appreciate the opportunity to speak about Governance and Human Resources Committee and our committee's current area of focus. Commit to fostering a healthy team environment that prioritizes our people well-being, health and safety as we respond to and recover from the demands of pandemic. Promote reconciliation, cultural safety, and anti-racism through Indigenous recruitment and retention strategies. Continued engagement with staff hired into COVID-related roles such as contact tracing, testing, screeners, immunizers, etc. Address turnover and vacancy rates and ensure shifts are being filled and staff are not working short. Repatriate housekeeping services. Collective bargaining with the NBA, HSPBA, GEU, and FPA. Strengthen partnership with post-secondary institutions. A provincial strategy for health human resources. Improve workplace health and wellness. Promote reconciliation and cultural safety. Promote anti-racism, diversity, equity, and inclusion. Increase leadership capacity and engagement. Recruit, attract, and onboard. Build an integrated provincial recruitment system. Enhance recruitment incentives. Increase onboarding force. Improve credential recognition and streamline immigration. Advance interdisciplinary team-based models. Review scopes, create and optimize key roles. Increase workforce flexibility to respond to staffing challenges. Build, connect, and update critical tools and business systems. Expand and modernize post-secondary education. Embed anti-racism, support Indigenous participation. Reinforce health authority, post-secondary partnership. Strengthen employer-supported training models. Health service delivery teams are accessible, team-oriented, and person-centered, engaged and motivated, skilled and competent, safe and healthy, supported and well-led, diverse and welcoming, mandate letter. Support the successful implementation of the key priorities. Ensure the health, well-being, and sustainability of the healthcare workforce. Repatriate housekeeping and dietary hospital workers. Implement workplace violence prevention framework and policy. Implement National Standard of Canada for psychological health and safety. Implement a health human resources strategy, which includes health human resource management system. Fraser Health Service Plan. Enhance respect for workplace psychological health and safety and resiliency. Adopt a culture of staff safety, focus on injury and illness. Prevention, attendance, and disability management. Enhance leadership development. Strengthen relationship with physicians. Strengthen management performance plans and accountability. Ensure stable staffing models. Improved focus on staff and physician total overall health. Human resources. Thank you. That's it. Thank you for the opportunity.
Thank you, Injit. You have a very busy committee, obviously. It's good. I'd like to ask Willie Chowdhury, who's the co-chair of the Aboriginal Health Steering Committee, to say a few words as well.
Kusai Jim, Chikwakwa Toskwi, Talitsa to Elis, Elacta. Just said thank you to Jim. Introduced myself with my traditional name, Chikwakwa, also known as Willie Charlie. Really happy to kind of give an update a bit on the partnership that we have with the First Nations Health Authority and the Fraser Health Authority, and that's the Aboriginal Health Steering Committee. Again, the partnership looks at how we work along with the First Nations Health Authority to deliver services to those within our region. One of the exciting areas is to look at the in plain sight report recommendations and how do we work towards implementing those within the Fraser Health Authority. With some of that work, we have 3 subcommittee working groups. One is feedback and accountability, which is co-chaired by Jesse Lee Hall and Chief Andrew Victor from Chiam. The recruitment and retention, right now the co-chair for the Fraser Health Authority is open and going to be filled soon. And that one's co-chaired, or the one that held that position before was Tom Kim. Tom did a great job there, so I wanted to acknowledge his work. And that one is co-chaired with Chief Derek Epp from Chiakten. Then there's the Cultural Safety and Humility working group, and that one's co-chaired by myself and Jim Sinclair. Again, looking at the work that is in front of us to eradicate racism inside Fraser Health Authority. So really important work, heavy work, some pretty exciting, I think, discussions to find out about how do we deliver culturally appropriate, safe healthcare services in the Fraser region to all people. I will leave it there, Jim. Thank you.
Thank you very much, Willie. Jesse Lahale, the Digital Health Committee.
Thank you, Jim. Digital health is a wide scope committee. I think a lot of our work has been propelled because of COVID, similar to us communicating with everyone today over Zoom. We've been trying to figure out ways of how to have higher quality care and greater efficiency using a lot of virtual techniques. Some really great successes have been clinical and professional practice and education, particularly the virtual diabetes patient education classes. To my understanding, we're offering some in different languages, but really focusing on patient designed and engaging ways that patients can learn about their diabetes and how to manage diabetes in real time and be able to access things beyond a short window of time and go back to programming as well, so they can relearn and engage at a greater level. Another really great thing within virtual health space is the overall healthcare, virtual care, really trying to figure out how to connect emergency patients, their aftercare through virtual care opportunities so that patient delivery is more seamless and more efficient. Beyond virtual health, complex issues like cybersecurity and integration of our Meditech system into the entire Fraser Health region, doing updates, and also a lot of it is future-proofing and figuring out how we can ensure we're using technology and delivering healthcare in the future, and obviously in the present. It's been exciting, particularly during COVID, understanding how virtual care and all these other dynamic conversations are moving at a very fast clip. And it's been great to have dialogue. Really looking forward to having more structured conversations and providing updates on our successes. Thank you, Jim.
Thank you very much, and thank you to all the chairs. The next person I'm going to introduce probably needs no introduction to most people in the region. She's the CEO, certainly has been the center of this whole thing from the very beginning, and it's an honor to introduce her, the CEO and the president, Victoria Lee.
Thank you so much, Jim, and the board members and the executive team that are present today, as well as all of the participants of the public board meeting. As mentioned, Fraser Health conducts our business on the unceded and traditional territories of the Coast Salish people, and we provide health services to over 1.9 million people across 20 municipalities, 32 First Nations communities, and 5 Métis charter nations as well. So diverse services for diverse people across the province. And undoubtedly, over the past 2 years, it's been some of the most challenging years with the pandemic, as well as some of the extreme weather events that were mentioned by Jim, and combined with the concurrent public health emergency of toxic drug supply and overdoses caused by them. I think within those challenges, we've seen our teams, what I refer to as our Fraser Health family of 40,000 people that work and volunteer in our region, rise up to those challenges with a great deal of fortitude, agility, as well as passion and ingenuity. I think by working with our diverse partners that Jim had mentioned, we've been able to ensure that our health systems can continue and our health services are delivered with extraordinary measures. I think some of the examples that have been shared publicly, that's what's very visible, was helicoptering in clinicians and equipment, at the same time helicoptering out patients during the extreme weather events out in Fraser East. So that's just one of the examples. But again, I would like to relay my sincere gratitude to all of the Fraser Health family for their unwavering efforts during this pandemic response and commitment to delivering care, highest quality care possible during tremendous challenges that we faced as well. I'd also like to share some of the capital projects where we have generational investments that have been made thanks to our provincial government. Currently, we have approximately $5 billion worth of capital projects underway. Some of the recent examples, for instance, is in November with New Surrey Hospital and Cancer Center, with a step closer to issuing, it's step close to reality in terms of issuing our requests for qualifications. In December, we also announced that CT scanner will be coming to Mission Memorial. We began our work in Burnaby Hospital campus for construction, which started in January, and also announced our second CT scanner last week in Burnaby as well. And earlier in the month, we've had constructions ended and the expansion work completed at Peace Arch Hospital, which has a meaningful impact on the people of White Rock and South Surrey, with better access to emergency and surgical services. So those are some of the examples of impact of our investments. And as Fraser Health, with the 40,000 people in our region, actually we're the largest employer across all of our 20 communities as well. So as we look towards to brighter days ahead in 2022, I remain optimistic that by working together with our partners, we can restore and rebuild and strengthen our system. The expansion of the capital projects, just one of the examples that we have, but with the lessons learned from the past 2 years, will make our health system more sustainable, just, and equitable. And I think the important work that's been mentioned by Jim around eliminating systemic racism, by working with our partners, we would like to ensure that we deliver culturally safe care to all in our diverse region. Just want to remind everyone that we can't do this alone. There's lots of work ahead, even with brighter days ahead. And unfortunately, we are seeing some concerns around behavior, aggressive sometimes, and sometimes quite concerning in terms of violent behavior towards the 40,000 people that I mentioned that I referred to as Fraser Health family. I have said this publicly before, that we have zero tolerance, and we will not accept and tolerate these types of behaviors. And it's especially important time for us to take care of our care providers so that they can take care of all of the population of over 1.9 million people in our region. So want to emphasize that we can't do this alone. We must work again collectively and commit to one another, and look forward to working with all of you to ensure that we restore, rebuild, and strengthen our health system, and to ensure that we make our health services more sustainable in the future. And with that, I'd like to thank everyone again, the board members, the executive, the participants, and the Fraser Health family. and all of the tech team here as well, and turn it over to our board chair, Jim Sinclair, to continue the meeting's agenda.
Thank you very much. And we certainly have a full agenda. We have submitted questions. We asked people to submit their questions, and we'll go through those questions. We also have social media feedback and a couple of questions from there as well. So the first question is from Chilliwack, is why is Fraser Health requiring people accessing healthcare services to take off masks, N95s, KN95s, that are proven to be more effective against COVID than surgical masks? Why isn't Fraser Health mandating and providing superior masks to HCWs, to healthcare workers, and supporting staff, maintenance, janitorial, etc.? Is it because FH is following the provincial mandates over internationally science-backed information with supportive studies? Why? What do you say to the class action that is being brought against FH by CEV patients? And I'll ask the Dr. Brutkin to answer that question.
Thank you very much, Jim, and thank you for the question. Just a few comments to start on the transmission of COVID. Historically, when we have talked about airborne transmission, we have been referring to pathogens like measles and tuberculosis that are transmitted via tiny little particles that can remain suspended in the air for long periods of time. And people who enter a room, say 2 hours after a case was there, can become infected by those particles. COVID does not behave that way. If it did, every one of our healthcare workers across all of our sites would have been infected during the first wave. So the transmission of COVID looks different. And what we have learned over the course of this pandemic, and there has been a lot of learning, is that COVID transmission probably happens across a continuum. And at one end of the continuum are large respiratory droplets that are heavy and fall out of the air in a 2-meter radius around the case and fall out very quickly. And at the other end of the continuum are smaller aerosols that linger in the air for longer and can infect contacts at a wider distance. And the transmission of the COVID virus happens across this continuum. Which mode of transmission predominates really depends on the circumstances. And we have seen the transmission more towards the aerosol, and under circumstances where there are large numbers of people present in crowded indoor spaces, where the ventilation is not great, and where activities like singing and laughing and shouting are happening. And the classic examples are crowded bars, choir practices, and busy gyms. So just that background on the transmission of the COVID virus itself. As far as the protection of our staff is concerned, the use of respirators in the workplace is governed by the Occupational Health and Safety Regulation. And the respirators that we provide to our staff and medical staff must meet certain safety standards that are dictated by the Canadian Standards Association. In addition, the staff who use those respirators must be fit tested in order to ensure a tight seal of the respirator that is effective in blocking the transmission of pathogens. All of our staff are expected to do what is called a point of care risk assessment, which means every time they enter a particular environment or come into contact with a patient or a client or a resident, they do an immediate point of care risk assessment to determine what factors are operating and what is the most appropriate way for them to protect themselves against the circumstances that are in front of them. And that includes choosing appropriate PPE in order to protect themselves under those circumstances, and that PPE is provided. So that is what protection looks like for staff. In addition to that, there is now a provincial policy that it's not specific to Fraser Health, but is across all of the health authorities, that requires patients and visitors who come into our sites to remove the mask that they have brought with them from home and don a medical grade surgical mask that is fresh and intact. And the reason for this is that we want to ensure that the mask is medical grade, that it is completely intact and is only being used once. As far as patients are concerned, while we ask them to don these masks, we would never deny a patient care because of the mask that they are wearing or the mask that they are not wearing. That has never happened. As far as visitors are concerned, we do ask them to remove the mask that they have brought with them from home and to don a medical grade surgical mask in order, again, to ensure that it is fresh and intact and is only being used once. However, there are some circumstances under which we have provided visitors with respirators. Those are very specific circumstances where the risk of transmission was deemed to be much higher. Say, for example, a visitor who's coming in for an end-of-life visit with somebody who has active COVID disease. And under those circumstances, we have provided the visitors with respirators. Finally, just a comment on the complaint. The tribunal has notified us that this complaint has been submitted, but has not commenced proceedings and has not provided us with any additional information. If and when we receive that information and a hearing takes place, we will respond in more detail.
Thank you, Elizabeth. The next question is from Delta, Christina. Why is this being held virtually and not in person? The elite are telling us to live with COVID, but are holding virtual meetings. Is this not hypocritical? Let me just say, there's no more people than the people in this room that would like to be in a room with all of you. And I think that's true for a lot of people. And we are looking forward to the time when we get back to that, because for years, that's how we did it. And for all of us, that's a more engaging process. But however, provincial orders limit indoor gatherings. And at this point, we are in accordance with those orders and in support of BC's pandemic response, so that we're holding it virtually. We do hope that at some point in the near future, we can hold our meetings in public again, and look forward to that day. The next question is Frankie from Coquitlam. Why are you placing positive patients in shared rooms with COVID negative patients? This is a clear example of policy that increases the spread of COVID, especially with highly transmissible variants in play. How do you justify putting COVID negative people already in a frail position while hospitalized at risk of infection, long-term health impacts, and death? Elizabeth? Brocken will answer that.
Jim, thank you very much, and thank you for this question, because it provides me with an opportunity to clear up some misunderstandings around this issue. The role of the infection prevention and control team is to place all patients in hospital as safely as possible, not just the patients with infectious diseases, but all patients. And that is on a background of many patients who are in hospital with infectious illnesses. And that's not just limited to COVID. There are other respiratory infections, there are GI infections, etc. And all of those patients have to be placed safely, as well as those who are not infected with anything in particular. That is also on a background of hospitals that are fully occupied. And most of the rooms that we have are not private single patient rooms. They are either semis or 4-bedrooms. And this all has to be taken into account about ensuring that the safety of everyone at the site is maximized. Our infection control teams have a very large toolbox in order to allow them to do this important work. And we have recently added one more tool into that toolbox, and that is the ability to place patients who are COVID positive, but not symptomatic, in rooms with low risk COVID negative patients. And I should mention that about 55% of the patients that we have in hospital with COVID right now are there because of their COVID illness. They're there for treatment because of the illness that they have. But 45% are not in hospital because of their COVID illness, even though they happen to be positive. That's just an incidental finding and is not causing them symptoms. So on all of that background, we developed a tool to allow the co-placement of COVID positive and COVID negative patients. It requires that the COVID positive is an incidental positive and is not symptomatic, and that the COVID negative is low risk and fully vaccinated, which is a significant protection against serious illness and poor outcomes. However, we have only actually done this once. And that was under a very specific set of circumstances where it was clearly the right thing to do to maximize the safety of the patients that were involved, as well as all of the other patients on the unit and the staff on the unit. It was the right decision under those circumstances. significant layers of protection were put in place to keep everybody safe, and no transmission resulted as a result of that decision. So it is a tool in the toolbox for our infection control team, but as you can see, it is a tool that is rarely used.
Thank you, Elizabeth. The next question is from Nellie in New West. When will getting your personal health records become automatic? Currently, is it a never-ending task? Hospitals allow themselves 30 business days time to supply the requested records. Life Labs has a solid system. Why cannot the medical community supply something similar? Recently, I caught an error on one of my medical papers, was happy that I asked for a copy. It is now under investigation. And I'll ask Jessie to answer that question.
Thank you, Jim. And also thank you to Nellie for this great question. I think firstly, it's important to really have a difference between access to hospital records and the records maintained by physicians in the community. Just for your information, Fraser Health has custody of hospital records, but doesn't have any control or custody or jurisdiction over records maintained by community physicians. For the part of the question, there was the 30 business day reference. That is the current service standard defined by Freedom of Information and Protection of Privacy Act, FOIPA, and within the Health Information Services. These departments work to provide charts for patients as soon as possible, and sometimes they are available 30 days before the time period. The province of BC is giving citizens access to some parts of their health records. This is a big change within the system. And some of those health records can be downloaded or viewed through Health Gateway and My Health, the BC app. And these solutions have access to prescription medications, COVID-19 test results, immunization records, health visits, and the BC and federal vaccine card. In the future, we're working to include lab results, diagnostic imaging, and lots more information. Fraser Health is working with the Ministry of Health to align citizen access solutions and coordinate future investment in this area. This is something that the Digital Health Committee is actively working on.
Thank you, Jessie. The next question is from Alicia in Mission. When will you allow unvaccinated staff that you fired back? If you're allowing COVID positive nurses to work with the public, why is there not an option for the unvaccinated to take rapid tests before shift start? Please explain. I'll ask Indrajit to answer that. Sorry, you're on mute, Indrajit.
Thanks, Jim, and thanks for the questions. Healthcare staff are required to be vaccinated through a province-wide order from Dr. Bonnie Henry. At present, there are no changes to that order.
Thank you very much. The next one is a question that I'm sure many people have asked, is why Fraser Health does not ramp up the admission procedures for healthcare staff, including nurses, doctors, specialists, and surgeons, to curtail the notorious wait times. And that comes from Samia in Surrey. And Indrajit, I'll ask you to give an answer to that.
Okay, thanks for the questions. The pandemic has an unprecedented effect on our healthcare system and on the health workforce. Fraser Health has experienced an increased need for staff in many areas, including intensive care and high acuity units, emergency departments, and our COVID-19 testing and immunization centers. We appreciate the ongoing efforts of our clinical and non-clinical staff who have worked hard and delivered services across all of our communities throughout the COVID-19 pandemic. While recruiting new staff into the health system is important, we must also focus on retraining the staff we currently have, as well as looking at new ways of delivering our services. We continue to actively recruit new staff to fill roles. From February 1, 2021 to January 31st, 2022, Fraser Health hired 1,923 nurses across our system, a 68% increase over the previous year. Fraser Health undertakes a thorough vetting process for all candidates. The recruitment team reviews resumes, set up phone screening conversations, works with hiring managers to arrange interviews, facilitates background criminal checks, confirm credentials, and coordinates offer letters. Candidates will often apply for multiple postings, which increases the length of the hiring process. In addition to posting jobs on our corporate website, Fraser Health has excellent partnerships with the post-secondary institutions provincially and across Canada, where we frequently host career fairs virtually during COVID-19 with students and graduating cohorts. We also arrange for practicums at our various sites for candidates who are qualified and interested. These are lead to successful hires into our system to best serve our communities. Fraser Health receives a large volume of applications and follows up with qualified candidates who are shortlisted during the review process. While we encourage all qualified people to apply for existing vacancies and appreciate the interest from all applicants in working for Fraser Health, due to the significant volume, all applications we receive, we are sometimes unable to connect with every person who applies for a position. Thank you.
Thank you, Indrajit. The next question is from Rapinder in Surrey or Delta. Do you have any plans to address the wait times for urgent and emergency care at Delta and Surrey hospitals? Patient area is often crowded due to people not having a family doctor and patients who are bringing their families into the patient-only area, forcing some patients to stand. It gets very busy. If it gets very busy, medication is handed out without documentation or explanation of what it is and how to use it. How can this be fixed? Manpreet.
Yeah, thank you, Rupinder. I think as a board member, if there's one complaint you hear out there in the community, it is about the frustration of the experience when you're in an emergency and you have to wait for a very long time. And I think the answer is both one in the system in terms of how the system can be improved and how people can be redirected to other services where they don't have to end up in emergency and not crowd the emergency, having the right care for the right people. The other part is the education in the community for people to self-select as well to see where they are going to go for the care. So the authority has, I think I mentioned that in my report as well, the whole PCN and UPCC system going on as well, where for the urgent care services, people needing a suture or something can be at an urgent care center after hours or when their family physician is not available, and have a much shorter time in terms of accessing that service and care. I think we are trying to spread the word out as much as possible too, because people are not used to doing that. People are used to going to emergency if they are feeling that there's distress. And of course, it crowds the emergencies. So really a point well heard, but it is work in progress. And the more information which gets out, the more diversity of services we can provide in the community where we can divert traffic from the emergency is something which we're looking towards as a solution.
Thank you very much. I'm afraid my computer just shut down for a second, so I'll have to ask Victoria to answer the question. I love technology. The next question. Do you have that question? Do you have that question in front of you? Yes.
I think the next question is for from Victoria, actually, from Abbotsford. And it says, how can the Vax Pact still be justified when it is proven that the Vax does not stop transmission? It just prevents more severe outcomes to the person who has it. In some cases, the vaccination pass is affecting the lives of many who cannot get the vaccine for religious or medical reasons. Why is there no exemption for these people? Is it okay to exclude these people from important parts of society based on their beliefs and medical reasons? Many of them have even had COVID and now have natural immunity. So multiple questions within, and I think probably best for Dr. Brodkin as the Chief Medical Health Officer to respond to this question.
Thank you, Victoria. And this is a great question. It touches on a number of things. It touches on the protection that the vaccine provides to individuals, whether or not being vaccinated makes it less likely that you will transmit the virus to others, what immunity following infection with the virus actually looks like, and finally, what the process is for obtaining exemptions. So the vaccine passport is something that those who wish to enter non-essential locations or events need to provide. And if for those who are unvaccinated, they are not able to attend those locations and events. And it was put in place to ensure that these settings, which have been identified throughout the pandemic as higher risk settings where transmission is more likely to take place, to reduce the risk of transmission in those settings and to avoid spreading the virus from there to the broader community. So touching first on the issue of the protection that the vaccine actually provides to individuals, BC-CDC has just finished a very nice analysis of the protection that is provided by 3 doses of an mRNA vaccine against the Omicron variant specifically. So this is made in BC data, and it is speaking specifically to the Omicron variant, which is the one that is circulating right now. Those who are fully immunized with a booster dose have 60% protection against the any infection. So if you have been immunized with 3 doses, the vaccine is 60% effective in preventing any kind of infection, be that asymptomatic, symptomatic, or severe. Perhaps more importantly, the vaccine is 92% effective. Those 3 doses of vaccine are 92% effective in preventing serious disease with hospitalization and poor outcomes. That is a very, very effective vaccine. There is also information about the effectiveness of the vaccine in preventing transmission. And the person who asked this question suggested that, in fact, it has no role in preventing transmission. There is a study recently out of Germany that suggests something different. And that study looks specifically at both vaccinated and unvaccinated cases and compared the risk that the vaccinated versus the unvaccinated cases would transmit the disease to their contacts. In fact, those contacts of cases who were fully vaccinated were 80% less likely to be infected than those contacts of cases who were unvaccinated. So not only does the vaccine provide a significant degree of protection to the individual, particularly against severe disease and poor outcomes, but it actually reduces the risk of transmission from infected cases to their contacts. And 80% is a substantial reduction in transmission. As far as the immunity that follows infection is concerned, and I would be careful about using the term natural immunity because there actually is nothing natural about being infected by a virus that is potentially lethal, but there is some immunity that follows infection. However, with the Omicron variant, that immunity is highly variable. And for those who have had milder disease, it is almost certainly not as robust as the immunity that follows vaccination. And finally, on the issue of the exemption process, there is a process for those who are seeking exemptions for medical reasons. At the moment, that is focused on healthcare workers as the first tier in order to ensure that we can get as many healthcare workers back to work as quickly as possible. But in fact, very few people are actually granted an exemption from immunization because there are very, very few reasons that would prevent somebody from receiving a vaccine, whether it's the mRNA vaccine or one of the viral vector vaccines. For the vast majority of people, it is safe to be immunized with at least one of those vaccines. And so medical exemptions, although they have been granted, are not common. There is currently no process for granting exemptions for religious reasons.
Thank you, Dr. Brodkin. That was illuminating, and I hope a lot of people can hear that answer. The next question is from Nicole from Langley. When will we be seeing the lifting of restrictions on access and visitation to residents in long-term care homes? The most vulnerable population is 100% vaxxed and boosted, and knowing we can't completely control a virus through lockdown, I believe our seniors deserve to see visitors they would like to again, unrestricted by the number of designated visitors or vax status. Lockdowns and isolation have devastating negative effects to health and well-being, and is unethical to forcefully continue. Again, Dr. Brodkin.
Thank you for this question, and it does touch on an extremely challenging issue, which is the balance between protecting those who live in long-term care, but at the same time upholding their rights to live their lives and to be visited by their friends and loved ones. In the early days of the pandemic, our seniors and elders, particularly those in long-term care, were the ones who were hardest hit by the virus. And we had some absolutely devastating outbreaks in long-term care with mortality rates that approached 50%. And as a result of those terrible circumstances, some very strict control measures were put in place in long-term care settings, including what happened when one of those settings went on to outbreak, the restrictions that were placed on the residents while the outbreaks were taking place, and restrictions on visitors. And those were very difficult, but felt to be necessary at that time in order to prevent the severe morbidity of mortality that we were observing. However, a lot has changed since those early days, and two things in particular have changed. The first is that we now have a safe and extremely effective vaccine. And although the immunization rates of our residents is not 100%, as the question suggests, it is certainly very high. And the immunization rates among the staff who are caring for them is 100% because of the current provincial orders that are in place. So that is the first thing that has changed. The second thing that has changed is the variant that we are dealing with now is Omicron, which, although it is highly transmissible and is certainly present right now in our long-term care facilities, is much less likely to cause severe disease, particularly among those who are fully immunized. So that has changed a lot of things, and the way that we approach the management of COVID and the management of outbreaks in long-term care has also changed. We no longer call outbreaks based on a single case. At the beginning of the pandemic, one case, whether it was a staff case or a resident case, and regardless of where that case had acquired their infection, that was an outbreak, and all of those severe control measures were put in place as a result. We no longer do that. The declaration of outbreaks is much more nuanced. It depends on what we're seeing in a particular facility. Yes, the number of cases is important, but it's not the most important thing. It's also what transmission looks like, how it is occurring, where it is occurring, and what the immunization rates are among the residents in that particular facility. So we are less likely to declare outbreaks than we were a year or a year and a half ago. In addition, when outbreaks are declared, the control measures that we implement are also not as severe. Only those residents who are actually infected and have symptomatic illness are required to isolate in their rooms. All of the other residents are allowed to carry on with their business as usual within the facility, and the events and dining and all of the other events that take place in long-term care are not restricted, even if the facility is on outbreak. And finally, as far as visitors are concerned, anyone who has an essential visitor, that visitor can visit at any time, and that doesn't change with an outbreak. And now every resident in long-term care is also allowed a designated visitor who doesn't have to be essential. And again, those designated visitors can visit at any time. And finally, Dr. Henry has promised that these measures will be reviewed again on the 14th of March. I'm sure everyone is aware that yesterday she announced the lifting of quite a lot of the restrictions that have been with us for many months. But the long-term care measures specifically will be reviewed again on the 14th of March with a review to lifting them if the circumstances allow.
Thank you, Elizabeth. The next one is, how do I get documentation of the result of my COVID-19 rapid test for returning to work or travel? Linda Dempster.
Yeah, thank you very much, Jim. That's a very good question. And I think, as everyone knows, there's two ways to get a COVID-19 test. One is through what we call a PCR. That's either through a nasal swab or a saline gargle. And those results are actually managed through our lab systems. So based on your registration, you will get a notification of either positive or negative results via text message or email. The other method is through what we call a rapid antigen testing. And that's now becoming very widely available to the public. You can go online on our website and actually book an appointment to get a rapid antigen test. That test gives you immediate results if you are actually COVID positive. And right now, based on the public health guidelines, if you are COVID positive, the guidance is to self-isolate for 5 days if you are fully vaccinated. If you are not fully vaccinated, that guideline is to self-isolate for 10 days. There is no requirement to have documentation of a negative test to return to work, as long as you've met those requirements for self-isolation. We don't offer COVID-19 testing or verify the results of for the purposes of traveling or school or employment. So there are some private pay clinics that offer testing for a fee to people who require asymptomatic testing for reasons that fall outside of the BC public health recommendations. And those testing guidelines are actually outlined on the BC Centre for Disease Control website. So I would suggest that you go to that website for some more guidance. So thank you for that question.
Thank you, Linda. The last question is, how can I cancel my COVID-19 test appointment? Hopefully you're canceling it because you don't have it, but
Yes.
hopefully.
Yeah, thank you, Jim. Yes, exactly. Hopefully that's the reason for cancellation. But in either case, if you are eligible for the test in the first place to book it, you should be receiving, or you would have received, an email confirmation of your appointment. On that email of course, contains important information on where to go and et cetera. But there's also an option to cancel your appointment and or possibly reschedule if that's what you need to do. So the email is the first place to be able to look and get all the information associated with your appointment, including cancellation. That said, we recognize that some people like to have the option around phoning or making the appointment through the telephone. And so to do that, there is a telephone line set up from 8:30 a.m. to 4:30 p.m., 7 days a week. And that telephone number is 604-587-3936. Once again, that telephone number is 604-587-3936. Thank you.
Thank you very much. And that brings us to the end of our meeting. First of all, thank you for the people who submitted the questions. I hope that the answers you got from our executive team and from the board members helped you to understand the situation that we're in. And they were good. You could always call the Fraser Health Authority if you have more questions or any questions that you have about your care, etc. I just want to thank the people who organized this. We're a tough bunch to organize at times, and the virtual reality is always a bit of a challenge for some of us with gray hair. But I hope that you've enjoyed it, and thank you for attending the meeting today. And thank you for having faith in us and moving forward and making sure that the best healthcare we can give you in a public healthcare system is being delivered to you. That's the challenge that we all face every day, all 40,000 of us who are part of the Fraser family. And we're committed to continuing to do that work. And we're committed to see the end of this pandemic, wherever it ends, and doing it together. Because from day one, 2 years ago, it's been the collective response of the community, whether it's isolation, or whether it's getting vaccines, or whether it's wearing masks, taking care of each other. It really is just about taking care of each other. And I want to thank you all for doing that. And we'll see you again at the next meeting. Thanks again.